I'm Antoni Chan, consultant rheumatologist from the United Kingdom, and I'm here in Eular 2024 in Vienna reporting for Room Now. One of the challenges that we have in axial spondyloarthritis remains the delay to diagnosis. And there are now many drives globally to reduce the time from symptom onset to diagnosis. And also, this gives us an opportunity to study the clinical features of patients who have early disease. And this was presented here at the EULAR 2024. Was an oral presentation, OP0310, which is a study of patients referred with chronic back pain to the clinic and then subsequently diagnosed with axial SPA. And this came from the SPACE cohort. And these patients who were referred with chronic back pain, they look for the features of clinical features of spondyloarthritis. They measured the acute phase markers. They had the HLA-B27, the radiograph, and also the MRI, and they followed them up over a period of time. And they were looking for patients who had the diagnosis from the time of symptom onset of less than 2 years. And then they divided them into patients with XPA and non-XPA and looked for the characteristics that would help predict the diagnosis of XPA in these patients with early symptoms. In total, they had 548 patients who were referred with chronic back pain. They asked the clinicians to rate their level of confidence from 0 to 10 in terms of how confident they were of the diagnosis. They looked at also the symptom duration, and overall the mean age in this group of all the patients who referred was 31 years, and the mean time from symptom onset was 13 months. About a third of them were male, and about 41% of them had HLA-B27. From the 548 patients that were referred with chronic back pain, 215 of them had a diagnosis of axial spondyloarthritis of less than 2 years. The mean time to diagnosis was 35 months. And so what they were looking was to see what were the clinical features in this group, and whether these could help predict the diagnosis in this early group. And they found that the clinical features of XPA clearly were higher in the patients who had the condition, but HLA-B27 positivity and sacroiliitis, both on X-rays and also MRI, were the strongest features at the start of the symptoms, and also this, when followed up at 2 years, were the best predictors of current and also the diagnosis remaining stable at the 2-year mark. And this gave the HLA-B27 and the sacroiliitis increased the likelihood of by 4.2 and 3.5 respectively. When they look at other clinical features, peripheral arthritis, uveitis, and also psoriasis raised the likelihood by 2 times in terms of the current and the future diagnosis of axial SPA being stable. Other clinical features included the response to NSAIDs, the male sex, and also of a younger age. On the converse, there were also features that were not strongly predictive of the diagnosis, including the first presentation of inflammatory back pain, were not a strong determining factor with regards to the current or future diagnosis of axial spondyloarthritis. So as we are increasingly trying to drive the time to diagnosis down, it appears that strong objective findings, mainly HLA-B27 positivity and also the presence of sacroiliitis, both on X-rays and MRIs, weighted strongly in regards to the diagnosis in these early cohort. These were then followed by some of the other clinical features as highlighted here in this abstract. So we can learn from studies such as this as we try to see patients much earlier with regards to their symptom onset and how we could be using some of these both radiographic features as well as clinical features to help us to make this diagnosis. I'm Antoni Chan, reporting here from Vienna at Eular 2024.